some new members, so certainly welcome everybody on board. And we'll start off with the Department of Social Services today. So thank you, Sarah.
Thank you. Thank you for having me. Good afternoon. I know a lot of you are new. Just to give you a real quick overview of the Department of Social Services, we operate all the public benefit programs. So that's temporary assistance, that's SNAP, HEAP, child care assistance, Medicaid, and child support, just to give you an idea. And I just did a recap of last year and the number of individuals we served in Onondaga County. So with one or more of our programs, we served about 140,000 residents with one or more of our programs last year. So we have a broad reach. With that, I won't take up more of your time. What we're asking is that we have $30,300 reallocated so that I can purchase a one-time purchase to have adjustable workstations for my temporary assistance employment staff. A requirement of anyone receiving temporary assistance is they must seek employment. And so we have a dedicated team of temporary assistance employees that work with every temporary assistance client, and they help determine if they are able to work. And if they're able to work, they help them develop a resume, figure out how to do job interviews, etc., whatever it takes to help them get employed. Or the other side is if they're not able to work, then they determine, is it a short-term disability, and they connect them with appropriate health and mental health services to address that short-term disability, and then they're back on track to be employed. Or the third track is they're permanently disabled, and we work on getting them Social Security benefits so that we're able to close the temporary assistance case, and then they get the federal benefit of Social Security. So I'm asking that we purchase this. I am all about trying to help my staff. Their job is pretty much sitting all day. So I've been trying over the years to equip staff with many things that help with their wellness. The rest of my staff have sit-stands. This would complete the process of having adjustable tables so that you staff can sit and stand and work during the day. So that's in essence what I'm requesting.
Questions?
Sit and stand, I've never seen that before.
Yeah.
Do you have a photo of it, or is there a way I can view what that looks like?
Sure, you can come on over anytime. We have various sit-stands where you literally, it's a shelf and you stand it up, or these actually will be even nicer. There's their table, and you press the button, yeah, and they move up and down.
We have in my office, I have mechanical workstations. They all have USB ports built into them now. The stand actually plugs into a wall. So it allows you basically to work in a standing position, a sitting position. It just promotes wellness.
Currently, this would be the last third to complete all of your staff.
Yeah. I started this process about 5 years ago. We have probably 400 some odd sit-stands now. This would complete the outfitting all my employees with the capability. When we're fully staffed, it's 470 staff in the Department of Social Services.
I'll make the motion. Oh, I'm
We
sorry.
have more discussion? Could you sort of run through the communication, the process? How does one of your applicants, how do they communicate with the office? Do they have to physically come downtown to Syracuse to meet with your staff, or how do you do that?
Every program is different, but for temporary assistance, people can, most come down first in person to apply, but we can help them through the application process through the phone. When it comes to when they have an open case, they actually need to meet in person with their temporary assistance counselor. So clients are often meeting with their counselor in these workstations that I'm talking about. So we try to work with clients as best as we can. When we can do the work by phone, we do it by phone. But when we need them on site, we bring them on site. If you get into other programs like SNAP or Medicaid, all that can be done via phone.
Or computer or something.
Yeah.
Because some of the population that you're working with might not have some of the resources to come downtown Syracuse.
Right.
And so if you live in Atisco or Spafford or
Yeah.
wherever, how do they get service if they don't come downtown?
Through the phone, and there is a website that the state has set up, and that allows them to submit their information, and we work through that application through that portal.
The centralization geographically is running counter to the decentralization of getting information to people through the computer and whatnot. And for those of us that represent the outlying areas, it's crucial that these people get served and not have to get a bus or a taxi or Uber or however to get downtown Syracuse.
Absolutely, and that's why most of our work can be done through a conversation over the phone. You're absolutely right. We actually discourage people having to come down here. We want to have them reach out to us by phone, and then we can determine, can we do it all by phone, or is there part of the aspect that we need to see you in person?
Because you need a special parking place.
Oh, I know, I know, it's very difficult down here. Yeah,
So my question is, we don't have satellite sites throughout the county?
no, not for the Department of Social Services, no. It actually would be very, very difficult. We're on the state network, and that takes physical ports, and the New York State is not implementing any more physical ports in the state. So until they can find a way in which we have a different way to access the state network, literally, that's why we're physically here, because certain floors within the Civic Center and the county office building have the state ports that allow us to feed right into the state network.
If I may wear my physical therapist hat for a moment, I'm certainly happy to hear that we're doing what we can to limit sedentary behavior, so I think that's great. I have a motion from Legislator McCarron. Do I have a second?
Second.
Okay, second Kevin Meeker, Legislator Meeker. All approved, all in favor? Aye. Any opposed? Okay, this motion carries.
All right, thank you very much.
Thank you.
Congratulations.
Thanks, yes, my staff will be very happy.
Apologies, one addendum before we move forward. Are there any corrections to the minutes of the last meeting? Seeing none, the minutes are approved. Next, we'll move on to the Department of Adult and Long-Term Care.
Good afternoon, everybody. Thank you for having us here today. So we are here asking for a total of $21,000 for two objectives: for shelf-stable meals and for accessible furniture for our 10th floor office. And for those of you who have your backs to that, I do have our request right here.
Thank you so much.
So shelf-stable meals, let me explain what that is. And I know we have some pictures of what a shelf-stable meal looks like. So shelf-stable meals are really delivered by our Meals on Wheels providers for frail and low-income seniors who participate in the Meals on Wheels program. So we are looking for $18,000 to provide a total of 1,800 meals to be purchased. Those meals come in, they're called blizzard bags, but they're actually boxes with shelf-stable soups or whatever someone needs to get this through what could be wonderful Onondaga County weather. Snowstorm, a blizzard, something happens, and Meals on Wheels providers can't get to the home. So the boxes usually have about 2 days worth of food, 2 days to 3 days. And if there is a power outage, not to worry, because you don't need a can opener to open them. They're all pop tops, or you can open them without any electricity at all. So we've been doing this for decades. And we've been doing this for decades. And what's happened is the cost of food and other costs associated with Meals on Wheels and our congregate dining programs have left us a little bit, I'll try to put it, out of pocket for purchasing these for this particular year. So we are looking to move $18,000 from our budget, and the money is coming from professional services or in our budget in 2023. We're looking to provide 1,800 boxes for people who wouldn't be able to access food otherwise. The second thing we want to do is ask for $3,000 for accessible furniture. So I know a lot of you have been on the 10th floor, but I'm not sure if you've sat in the chairs. So if you do, the likelihood of you getting up is going to be a little bit difficult. So we are looking for accessible furniture. On our floor, we have adult and long-term care services, but we also have adult mental health and veteran service agency. Between the three of us, we have a lot of visitors. Many of them are physically impaired. Many of them need bariatric chairs. Many of them have to stand. And that's not a respectful way for us to do business. So we are looking to purchase some accessible furniture, and I just happen to have some pictures
Lots of pictures.
kind of what we are looking for. And I know Rhea does our blizzard bags, and she is pretty much a blizzard bag expert. So do you have any questions about that?
Thank you.
So we are looking at Less Pro, and we conferred with facilities management on the accessible IDA furniture, and they've been very, very helpful. We're looking at this company. It's Less Pro, L-E-S-P-R-O, and we do have a state contract. So that's good. So we're looking for maybe 2 chairs, another couch. Maybe would fit 3 people. And then when our staff or the staff from other departments go out to help people, the table sits really low and people can't bend. So we're looking to up that as well. $3,000 may or may not be enough money, but we're
Is there any discussion?
How many chairs do you have up there?
I'm sorry?
How many current chairs do you have to replace?
How many current chairs?
Chairs.
I can't hear you, I'm sorry.
We have a couch,
Oh.
and then we have 2 chairs.
Thank you.
And so what happens is, if you can imagine somebody with a walker or wheelchair or a cane, when they sit down, because they're low, they can't get up. So a lot of them come to, as we all know, it's difficult for them to do things over the phone. So they come to our department to fill things out for HEAP or for insurance. And then they come, and then we go out there and meet them because we don't have a lot of space to meet a room. So if we have these accessible, these chairs, you're a physical therapist, right? It's easier for them to get up.
So we're talking about 3 pieces of furniture
Yeah.
total.
Yeah. 3 pieces of furniture, possibly 4, that we would be working with. Yeah. And I apologize, but I have hearing aids and I couldn't hear you.
That's okay, that's fine.
Thank you.
Thank you.
I thought you said chairs, but it wasn't sure.
That's all right.
As far as the blizzard bags, I understand that there are other circumstances that could require the blizzard bags if there are transportation issues, anything like that. But here we are, February 21st, I think it's 50 degrees outside, potentially with most of the winter weather behind us. So what's your typical usage of the blizzard bags throughout the winter? Do we have a stockpile that we haven't had to dip into yet? What's the purpose of this purchase as far as supplementing whatever inventory we have in stock at the moment?
So these were purchased in November, already. We already bought them.
Okay.
They've all been distributed, just because we don't want to wait until the storm hits, right?
Yeah.
So, in the past, historically, we've always purchased them earlier. We distribute them out just in case we have a snowstorm, which we've had past years, but we haven't had it this year. We get it ready for them. So, and then in the past, when we really had real winters, we would purchase a batch in November and then purchase another batch in January. But obviously, we haven't had big storms, so they still have them.
So this is addressing some of those cost overruns that were mentioned before?
Yeah.
Okay.
We're one of the few counties that really does. Not every county does a blizzard bag or a blizzard box, so, it certainly it was very helpful during COVID, but it's been helpful for, as I said, as Maria said, more than 3 decades. So it's something that people can rely on an annual basis.
Yeah, that's true.
And all the meals meet the dietary requirements for this age group, so they're not getting unhealthy meals. You're getting healthy meals
So the cost of this bag is $10
for 2 days. Yeah,
for 2 days.
2 days, and they get 2 days worth of 2 meals
And it's distributed by local Meals on Wheels.
by the volunteers. So in November, when they got them in, when they delivered the regular meal, because you know how Meals on Wheels work, right?
Sure.
You have somebody come. They also have these boxes they deliver to.
That's great that we have a partnership with Meals on Wheels, and they do that for us.
Well, we subcontract with them. So we have, we're the Office for Aging, we give them money to provide Meals on Wheels and also Conduit meals.
Okay.
So we have a contract with North Area Meals on Wheels, with Syracuse Meals on Wheels, with Meals on Wheels of Eastern Onondaga, and Jewish Family Services. So we provide kosher meals and meals to the outskirts of Onondaga County and also the city. Our biggest one is in the city. We'll serve about 800 people there. So every year we provide them funding. And then we also, with the funding, we provide funding for meals. We also provide case management. So they get a meal funded by us, and then we have case managers that go out and do an assessment with them and find out what other services they need to keep staying at home. So like they need help with SNAP or help with HEAP or help with, name it, we do it.
Wonderful. Thank you.
It is a wonderful, you should come out in March. It's March for Meals, deliver Meals on Wheels in your area. And you'll get, it's nothing like seeing a senior come to the door and you're the only person they'll see.
Yes, I actually did that last year.
You did?
It was a lot of fun. I had a great time doing it, to see the people smile when I showed up at the doorstep.
I know, really, just the simple things that remind you what life is about, right?
To us.
Yep.
All right, thank you.
Any other discussion? Do I have a motion?
I'll motion.
Legislator Maker moves it. Legislator Harvey, second. All in favor, say aye.
Aye.
Aye. Any opposed? Okay, and the motion carries.
Thank you
both
very
so much
much.
for
Thank
coming.
you.
And moving along with our agenda, we'll talk about a transfer resolution with the health department.
We don't fund them, but they have people that need funding, so we still get names North Air and North Alabama.
Michelle,
Hi,
how are you doing?
I'm fine, thanks. So we have a series of year-end items that did not make the budget, and given the balance in our budget, we think these are either gravely needed equipment items and/or greater efficiencies. So I can go through them rather quickly. The total amount is $326. You've got our individual sheets, and quickly, the MEO, we did not do we did the biohoods in the Center for Forensic Sciences lab. We did not do them in the tox lab in the MEO side. So while it is still toxicology, it is not connected to the CFF, to the laboratories. And then we are also requesting, we have the Lodox. I don't know how many, I'm seeing new faces. So the Lodox is our new full body X-ray equipment, which we were rather giddy in February when we received this because it didn't come in until February. But it's a beautiful piece of equipment that allows the ME to be able to take full body x-rays, which is really cool. For those of you who've not seen that, is that we've had, bodies are bigger than they used to be, and we had our techs that had to move the bodies. And while I don't mean to use this, I've never really quite understood it. My brother-in-law lives with me, and he's severely handicapped, and he fell. And dead weight is really dead weight, and it's different than at the gym where you have a nice handle, and you really can't move them. And so we had a number of our forensic attendants had been really quite, had been straining backs and things. Irrespective, what this is for, with the new piece of equipment that went in, we went into our x-ray room where we used to have more room, and we need counter space. So we need counters and cabinets. And so that's just because you had done the floor in the original infrastructure when we bought the Lobox. Floor replacement was done. We didn't think about the cabinets in our project. So that's the ME outside. Data capture and visualization software, that is Tableau. This is something we'll be using both for, we're in the midst of our reaccreditation this year, but this is something we're going to use to present on our performance management system. So all of our programs are identifying their performance measures, and we need to think about a dashboard, and we're just really not at the county, so we thought this was a very reasonable first step. This will be used by our key QI quality improvement team, who will be using this to inform the entire county and staff what our metrics look like. The MEO scene vehicle, we lost a vehicle right after the budget was passed, and that was kind of a kick. So the web garage took it out of the vehicle that we had lent them already from environmental health, and so they took it out of commission, and we are lending them another one from our summer teams, our vector teams vehicles. But we need to have we get these SUVs to go. We hand them out to our forensic investigators who are on call 24/7, and they're going out. Obviously, unfortunately, as you know, accidents happen at all times, and so they need to be able to breach them. So they've done things like they've had to go to the quarry. They've had to. They go everywhere. Unfortunately, so that's why they need to have the vehicles. They need to have them 24/7. They need to have them that are all-weather gear, and we have a relatively large community, and so we have a need for at least two. We often have two forensic investigators going out at the same time to very different places. It's not something, you don't want to leave a crime scene sitting for a wall, obviously, and that's something we won't do. The last two items are tablet replacements. We had hoped to use the tablets, the Microsoft tablets, for our field work. So we gave them to environmental health. If you've seen, we have great videos now of our investigators, our inspectors, going out and doing restaurant and motel, pools inspections, and they are more fragile, and the batteries are going quickly, and you don't replace these batteries. You buy a new tablet. So it didn't seem to us to want to, we are starting to have them start utilizing just the laptops. So we are making this last final push into replacing equipment for our field work. The other piece is for our nurses in the clinics. So we're using Medint. The charge is by unique logon, not users. Wasn't our choice. Wasn't a choice provided to us to choose a different pricing scheme. So we are paying 1 and 2 and 3 licenses for a single nurse. And it just doesn't make sense because we're using these small tablets in the rooms. The nurses can then go to the nurses station, and sometimes we have them up at the front. So it just seems like this is a far better tool for them just to be used to one lightweight laptop. And obviously, the nurses don't want to be carrying around giant laptops. So it's just technology has gotten to a place where it's really quite useful. And lastly, Dr. Anderson brought this up last year. We are supporting Upstate's, and I am not going to say the doctor's name. She knows him, and she loves ticks and vector and dengue, and she's all over this. And the next time you see her, I welcome you to ask her about it. But what we're supporting is the Central New York Tick Institute. Sort of, they're now taking in local ticks. It is, if you've read, we're the first sort of citizen collection point Upstate is, and as you know, and Wadsworth is changing even more. The Wadsworth is going to be moving in the next few years. In Albany, it's the New York State DOH lab, and they're going to start working a little bit more on doing more DNA testing on communicable diseases, and so they have kind of shrunk down their arbovirus. They're still doing it, but they are only taking ever from us in a year 50 ticks. That's it. 50 ticks. Well, that's great. It'll definitely give you a sense. I mean, it's sure, out of 50 ticks, it's fine. It doesn't tell you the level of incidence in what we're having in Onondaga County. So, and you're going to hear later from the CNY, the Tick Alliance, but this is we consider this a really vital sentinel service for us. I believe that if you've ever had a tick on you, if you haven't, you're lucky. If you do, you think everyone else who says, I had a tick on me, and you're like, yeah, you take tweezers, you pull it off, you grab some, make sure you grab it by the get really close to the skin, pull it out, directly straight out, clean it up. What's the big deal? Until you get one. And after you get one, by the way, you'll get more than one. So luckily, and I imagine for all of you, it's annoying. My boss loves ticks. I don't know how many of you know that. So I could bring mine in, and my boss knew exactly that it was a dog tick and not a deer tick, which is, I didn't realize there were dog ticks. So, but the point is that this is a very useful service for our community residents. So besides just the public health sentinel, it's something I think all of our community residents would like to have. And so this is going to support Dr. T, I'm going to call him Dr. T, Dr. T's lab.
Okay, do we have any discussion?
Yeah, I have a question about the laptops, like where are you purchasing them from, or what the cost?
It's our IT contract. So IT has a contract with Dell. It's the purchase department comes up with a contract for our.
Do you have the specs, like what actual laptops they plan on getting, the cost of them, even the cost is more than it. It's a lot for a laptop. And
it's $1,000.
Yeah.
It's a laptop. It's really not. It's got the docking station, a lightweight full with the kind of like the 512 and the memory. If you want that, I can certainly send it to you. That's not a problem, and we have it. Probably get it sent over while we talk. Go ahead. I mean, yeah.
that's the only question.
Yeah, it's what the county IT department recommended for us. Hi.
I have a question.
Okay.
From your presentation, it sounds like we're scaling back the TIC program when I think we should be ramping it up. And
We're not. New York State Department of Health, the Wadsworth Laboratories in Albany, it is the New York State lab.
okay.
So they do, there are no, and that's why SUNY Upstate's lab is so critical, to be perfectly honest with you. There are not a lot of community labs in central New York. So we don't have the same kind of background, the massive infrastructure like many cities do. Rochester has a number of technical colleges and medical schools, and we have medical schools, which is why we have Upstate, which is why we're supporting doing this. Until you get federal funding and lab and dollars for the research you're doing, so it's a cycle, really, once he's now published, and they're publishing this citizen, his approach, and if you saw Katie's, if you read our packet online, you'll see a link to the SUNY's. You'll see a link to the SUNY website. And so he's just published, and it's just, so he provides a lot of the data on like what the data is that he's seeing. You can see that. And they talk about this is what the lab looks like, but it's on that link in there. So the New York State is always going to test for, arboviruses have a tremendous impact to all of our communities. So obviously there are a number of new tick viruses they're migrating. So the Lone Star was on one side, and we had the Rocky Mountain, and so we are finding a continual evolution of the vectors of disease that are in central New York. And so New York State wants to know that, but they don't have the resources to test ticks regularly. So they're moving on to as a lab, like the CDC, they're not focusing on that. They're still doing it, but it's sentinel. It's just a small percentage of what they'll be doing. So they'll be doing some, and that's why they're not really scaling back. They've been doing this pretty regularly for the last 5 years, where they've kept it at just 50 ticks a year.
I'm not very sophisticated in this, but what you're saying leaves me with this impression that the state is just sort of, they're just not being very aggressive in this really public health issue.
So I would, may feel that way. I think the bottom line is that they believe from the tests that they're getting done, from what because don't forget, they're getting it from all of the counties. Every county sends in 50 ticks. So they're getting it from all of New York State. So the relative incidence of what the disease is known. So, and that will change if you find something new. So Western New York just found, and I wish I remembered it, I'm so sorry, I was on a call with Wadsworth yesterday. They have an individual who has a immune response to a different kind of tick that is not very common here, and she is now not able to eat any animal products. So it's triggered an immune response, and it's the first time we've had one in New York State. It's in Buffalo. I'm not sure where she got it, so don't get excited that I don't really want this. We'll have to worry about giving up cheese because that would kill me. So when that happens, they literally trigger labs where they're looking, and it gets organized by Wadsworth. So Buffalo's doing their own, they have their own lab. The Erie County Health Department has their own lab. They're working with their hospitals, but Wadsworth is looking at that. So when you have those, so you get an incident at any place, and it triggers a different kind of response. The bottom line is that we consider Lyme disease endemic. So you can expect it. So there's not, what we can do is more in the DEC side with pesticides, and it's not as much of a public health where I can control your behavior. We talk about using pesticides and wearing long sleeves and thinking about where you're going and in terms of high brush and cutting it down. And that's about all we can do. But you're not going to be spreading it from a kiss. So that's where the health department, I would still, do you see what I'm saying? So that I don't think that they're trying not to, and please don't think that they're going to dismiss arboviruses. So, you can imagine that, for example, if we start to see dengue, which we are starting to see for the first times ever in the continental U.S., in Florida and in Dallas, if that starts to change, it's going to affect a lot more people. So, and you'll see more changing, you'll see more response to that and more testing.
So you've got two-sided approach. You've got the research side, and then you've got the public side, where you have to educate our population how to be safe.
Yeah, I think seeing what time, the tick
If
alliance is going to help talk about that.
We've got to pick up the ball and run with it to protect our own people.
Yeah, and that's why we think it's really important to know, like we said, one of the best ways is to have the resource so that if you find a tick on you, you can know what it is. And trust me, if you didn't know if you know what it is, and if you know that tick carried Lyme disease, I would tell anyone who ever had a tick, you should be calling your doctor and getting your 24-hour, you should be getting prophylaxed, and that you should do through your public health doctor. We should be having bigger conversations about who maybe doesn't have a public health doctor and how are we serving them. I'm not sure what.
Because I've been.
Yeah. It's not
It's
fun.
not fun.
No. Hi, there's Lyme disease, but so far, so good.
So I have a few questions on the Lyme component and Dr. Thingamani.
Thank you, sorry.
If I remember in the 2023 budget, we had allocated some funding initially, and then we came back and appropriated some more to the Lyme and Tick Borne Disease Alliance, as well as Dr. Thingamani's lab. Do we have money in the 2024 budget? So this is new money that we aren't currently appropriating.
And I think the point being that is we had really hoped, and I got, if you want to.
I can speak to where the money actually came from.
Yeah.
I know 2022 for this SUNY upstate piece, we appropriated $50,000 at the same time last year through the year end.
So that was taken through 2023 with the success of the project and different things like that. That's why they're coming back to you at this point. There is not any money for this program in the 2024 Health Department's budget.
Okay, thank you.
Yep.
And as far as the status of the lab, I remember previous discussions, if I remember right, there was a threshold that they were working towards up until which they weren't going to be able to resume testing. So if any of you have any updates on the status of that, feel free to jump in. That was something that I remembered from some of our previous discussions.
So we can tell you some things, and some things are upstate proprietary.
Okay.
It was $550,000 a year that Saravana needs to run the lab, and that was the threshold. There are discussions now to try to figure out how to open the lab under different conditions.
Okay.
The details would have to come from us.
Yes, they desperately want to reopen the lab and trying to figure out how to do that, you know, with a fee schedule or something. The lab is needed.
So short of reaching that threshold or coming up with an alternative plan going forward, do we have any concept of what this funding will help them to accomplish?
Yeah.
So Katie's talked to.
Yeah, we can't.
But the idea is that this would open up for this season testing for Onondaga County. So as they identify potentially a fee schedule that we would get 50% discount for
Okay.
OCHD. I believe he's still working on federal grant funding, which would open, we had all hoped we'd be a little further along
Sure.
in that funding sort of, I don't think anything's been turned down, but I think we had all hoped that it would be a slam dunk, so to speak. And it's, the wheels of bureaucracy, you know, sometimes we're quick and sometimes we're not. So it would not surprise me going through the fence. So that is still a work in progress, but this is what this would allow us to do.
Okay.
That is what the expectations are for this summer.
So
That the
that's
fee schedule will be cut in half for Onondaga County.
certainly an issue that we'll revisit in today's agenda, but for now, do I have a motion for
I
item
was
3?
gonna say one thing before you do that. The laptop thing, can we like table that until like next month? Until I see like the budget, like the breakdown?
I don't know that they have control over the laptops. It's basically, we're just approving funding, it's whatever the county IT, right? We have to go to our bid contracts on that? Yep.
So yeah, so those contracts are bid out through the purchasing department. So we go out to bid for those type of things. So whoever the lowest bidder is at the time, or it's bought off the state contract. So the prices that we have are going to be the best that we have for the time period. My only concern is that this is for
Surplus 2023 funding. So we're in the process of getting the books closed down. So using 2023 funds, we would really need to do it at this time. If you tabled it, it'd have to be a discussion on appropriating 2024 funds. So I just wanted to put that out there.
I'll make the motion.
Okay, I have a motion. Do I have a second? Legislator Bush, all in favor?
Well, I'm sorry, I have one question before we go there.
Sure.
I just like to go back to the vehicle. I'm a little confused, and, first of all, I think it's very important that the investigators have the best equipment to get where they gotta get, when they gotta get there. Is it 2 vehicles, or is it 1?
One.
1. So the cost of the vehicle is $45,000.
Mm-hmm. It's a Ford Explorer.
Okay. And the budget is for $95,000.
The other 40 is for the cabinetry and
Oh.
in the load ox room, in the extra room for the load ox machine.
Yeah.
Thank you.
Yeah, absolutely. I have a motion and a second. All in favor?
Aye.
Aye. Any opposed? Okay,
Last one is the Finger Lakes float up.
resolution carries.
So, Legislator Bush will remember this. I'm not sure if you were here. Yeah, Chairman. We receive funds. We are a pass-through agency through the state, New York State DEC. So, and obviously this is designed to help our waterways. So what the state does is the DEC gives us money. We don't use any of it. We hand it out for these projects. And it is determined by FLOPA, which is this tri-group. This is it's an organization of counties and DEC agencies that identify what the needs are. So as you'll see from this, the one I think we've only ever really done in the last couple of years then is our the water chestnut harvesting and some of the lake, the Tully, Atisco, where it's identified that it's the invasive, it's the same thing, it's the invasive species. It may not be water chestnuts, but it's the same type of lily, it's a lily, and they clean it out so that they don't suck up all the oxygen and your lake stays healthy. So we do this every 5 years, so that's why it's a legislative, Ben can speak to that, this is a document that just allows us to enter into this relationship so the funds can come to those agencies. It is not designed to go to us, it is designed to go to them. This is the mechanism that they use.
It's a pass.
It's a pass-through, it's like a purely pass-through.
I didn't
Things
think
that we
we did an administrative fee either.
We do not, we get nothing. But we do help, obviously, with our community. So when we are going to pull and if we're gonna treat water chestnuts in Seneca River for everyone in the Beeville area, we wanna make sure that everyone knows, because you'll see us on the news saying, yeah, don't go swimming for this 24 hours. So we try to keep everyone up to date. If it rains, sometimes it gets moved. Yes, that sounds like the mosquito spraying for vector, but it actually does impact the water chestnut treatment also.
Any discussion? Do I have a motion? Legislator Bush, do I have a second? Legislator Meeker, all in favor? Any opposed? Okay, motion carries.
Thank you kindly.
Thank you, Michelle. And we can revisit our conversation regarding Lyme and tick-borne illnesses. So I'd like to welcome Rael Scuderi and Ann Messenger.
Didn't realize we were coming in after a conversation about one
I
of
know.
my heroes, Sarabon and Tangamani, who runs that lab. We might be able to answer those questions too.
Which was a late addition to the agenda. I thought it
I was
made for a
thrilled.
nice segue.
Anything I could do to second that motion to get him more money, I'm in. I'm Ann Messenger. I am a board member of the Central New York Lyme and Tick-Borne Disease Alliance. I'm here today with our wonderful executive director, Rael Scuderi, to ask for $75,000 in this year's money. That is actually, Cody, the first time we will have received any county money, just to be clear. We have a lot of information, hard copy and up there on that screen to share with you. I'm hoping you'll walk away with being smarter about Lyme and tick-borne diseases. But before we, especially Royale, gets into it, I'm looking around the room and I'm wondering how many people, with a show of hands, legislators and beyond, have either directly had some kind of tick-borne disease or know of somebody, a child or a friend. Anyone?
Sure.
So there are 20-ish. Yeah. 20-ish of us in the room. I'm guessing, because I see heads nodding, you know that this is a big deal. Our board is comprised of doctors, scientists, community members. Our docs and scientists are very calm in the face of this. When they use words like crisis and epidemic, it gets my attention. all of that said, I'm going to point you, maybe you want to turn around and look at the screen.
Is that these slides?
Yeah.
I can just
handouts
follow
with,
along.
Great. There's a space for notes too, if anybody, here, I'll just do something.
Thank you. Thanks.
And by the way, Ken, when you were speaking, I turned to Royale and said, we need to hire this guy. We can't afford to do that. You want to come on board as a volunteer.
Excellent.
I'm going to turn this over to
All right,
Royale.
good. So these are slides with notes. I sent the PowerPoint to Jamie. We can send it out afterwards too. There's a lot of information. I'm not gonna read all the slides. We don't have time for that. But I'll do the highlights. So this is just highlighting where in Region 4. From 2008 to 2018, there was a 439% growth in Lyme disease, just Lyme disease, according to Department of Health. So that illustrates the level of epidemic just in this region. And you'll see the regions around us, you know, downstate has a downswing, but all of upstate is just exponentially growing and continuing to get worse every year. Oh, it has nice fading and such. There we go. So this is just going through some of the challenges. One of the challenges is how tiny the ticks are, especially in the nymphal stage. You can't even see it. It looks like a poppy seed. It's no wonder nobody sees them. You don't even notice them. And that is unfortunately what we see in May, June. They're tiny. So that's a major challenge with diagnostics and with people realizing that they've even been bitten and needing to go to the doctor. That's one of the challenges. A second challenge is rash variation by size, shape, appearance, and made even more so on darker skin. So the bullseye rash on the right, that's really rare, honestly. Almost nobody looks like that. It looks like a regular rash, or sometimes it's just a red. People think that it's a dermatology sort of thing or whatever. So they don't really look like that. That's kind of a myth. And half of people, at least half of people, don't get a rash. I didn't. I'm one of the typical that did not get that. So that, again, makes it difficult. People don't know they've been bitten. Doctor doesn't know that they have it. They don't see the rash. That makes it harder. Another challenge is complex symptoms. And you'll see from early Lyme to chronic Lyme, they differ, but many of those symptoms just mimic other diseases, which makes it very, very difficult. And if you've missed the acute stage and you're into, it's chronic Lyme on here, but we'll say late stage, as I was, it was probably a year maybe before I was diagnosed. I was already in late stage disseminated. So I didn't have the flu acute. You didn't know it. It just got worse and worse. So I was already past that. So I didn't look like what a doctor would expect, a typical Lyme patient. And the more I hear those stories, lots of people don't look like the typical patient. So that makes the challenge harder for doctors. This is just growing rates of other tick-borne diseases, specifically in this area in upstate New York. We've seen over the last couple years, according to what Sarah Bonin is seeing at his lab with ticks, pathogens, and what our infectious disease and general doctors are seeing in terms of diagnostics. Anaplasmosis and babesiosis are becoming more and more prevalent. So we've started including that in our public education and in our doctor-provider education, because it's not just Lyme disease they need to be looking for. And often the symptoms are very different. I had babesiosis and Lyme disease. Well, babesiosis is very much like malaria. It's a cousin of malaria. So when you put that together with my Lyme disease symptoms, I didn't look like anything typical. It was weird. It was a very complex puzzle. So again, that just complicates. It's not on here, but what the presenter previously was referring to is alpha-gal syndrome. That's the meat allergy. That does come from the Lone Star tick, which we do have in New York State. It's been predominantly Long Island, very downstate, but we thought we had more time. We thought we had more time. It's coming. And if the Buffalo case is true, it's here. We thought we might have a couple years, but it's here. So we need to be looking for that as well. So it's just more ticks, more diseases, more things to be educating people about, and for doctors to be considering in their differential diagnosis. This is complexity, the long hauler symptoms. When you're missed, like I was, and you didn't get diagnosed or you're misdiagnosed or not treated sufficiently, you then get into a long haul, similar to a COVID long haul. And this is all of the symptoms, which sort of just illustrates there is no typical, right? It can look like so many things. I'm sure you've seen that in kind of what you do. I'm sure you deal with people like me with chronic pain and all of that sort of thing. It takes a toll on in a chronic disease fashion. So this is just a really quick, a lot of information here. Again, you'll get the slides, but this is just kind of highlights of the cost to patients. That 35% of patients spend more than $10,000 on tests, treatments, appointments. I ended up $60,000 in debt. Took me a year to get diagnosed, another year for treatments, 3 years I couldn't work, then underemployed part-time for another 4 years. So it takes a toll financially. 45% of patients spend more than 3 years getting proper diagnosis and treatment. 65% have to quit their job or cut back their hours. 24% have seen more than 10 doctors before they get a diagnosis. 76% are unsuccessfully diagnosed with the older traditional ELISA Western blot, and 86% suffer long-term side effects due to initial diagnosis. Joint pain, brain fog, memory loss, insomnia, neurological are the most common. I was lucky enough to finally actually get a legitimate, a positive test. All of the other ones are me. So I'm a walking, talking. Here I am 13 years later with chronic pain, arthritis, neurological, memory issues, mental health, those sorts of things, which we live with. The cost, this is just showing again the long haulers continuing to increase every year because it's about, let's say, 20% ballpark of cases that go on to develop what we call post-Lyme disease treatment syndrome, long haulers. So we're adding every year 20% of the cases to the cases that are never resolved, that have the lingering symptoms, right? So the burden of those chronic illness just gets bigger and bigger and bigger. And this is, again, the state and the federal government are years behind in their tracking. So that's also an impediment, right? You know, we just don't have great numbers until years later. So that makes everybody's job more difficult. This is just an overview of the programs and services we provide. Community education being our biggest one, provider education, patient advocacy support group, ticket distribution, youth education. This is just some of the stuff that we do. And this is our progress to date. So we're 4 years in, and in our short 4 years, this is now, we're in 3 counties, Onondaga County being our first and our biggest. You can see the 146 events, 12,493 attendees, 4,500 youths, 6,000 tickets. You can see it all, 17,000 handouts. It's just 3 million media impressions. So it's just amazing what we've been able to do in 4 years. And we're always adding because the problem continues to grow. And the more we get in it and we're talking to people, the more we realize, oh, we need to do this too. So we are currently piloting a K-12 education program with our area schools. We have a few schools that we're working on right now, developing curriculum. One of them is Syracuse City School District. We've got a few schools within that district, Chittenango being rural, and I think we're looking at maybe FM or another for a suburban. We're trying to do an urban, rural, suburban, so that we can test out the type of curriculum and materials and the way of presenting that works best in best different environments and demographics and those sorts of things. So this is a testing year for that. But the idea there is to develop this into something that we can eventually do train the trainer and have it move beyond us so we can scale it up. And it could be something that the teachers could give in the way of videos or something like that that would just not add to the teacher already overflowing plates. We understand that. We've had good reception though. The school nurses and the school health teachers they see it, and so they're eager to have something to help the kids. And we all know the kids are most at risk. They're the ones out there rolling around in the grass, playing the sports, going off the trails, whatever. The highest burden in the country is 4 to 14. So we really want to try to get to that age group if we can.
What age group school kids do you try to focus on?
Right now, our initial focus has been about middle school. Because there's a robust health curriculum at that age group already, and the health teachers are in the classrooms, and it's they're old enough to really understand things, but not so old that they don't care anymore, right? It's just kind of I think you find that with drug and alcohol and have all their health issues. That's the kind of prime age where you've got some mind soaking up. So we're starting there, but we do have curriculum for older and younger, and we have done a few we have done a second grade and a 10th grade. We've done those, but right now we're focusing on that middle school, so we can try to do all the middle schools, which would be lovely, and then keep growing up and down with curriculum, maybe at like a 2 or 3 year, like K through 2, 3 through, basically the curriculum has to be different for each age group because the learning objectives are different in kindergarten than they are in 10th grade. So
is this an area where we're able to really identify the incidence of Lyme and tick-borne illnesses by zip code? Do we have data to that granular level, or?
No, I mean, unfortunately, the state just doesn't collect them. So there's no good reporting. Sarah Bonin can tell you how many ticks were sent in,
right,
but nobody actually knows. And the New York State Department of Health, our case numbers are, again, I forgot what she called it, but it's sampling. It's essentially sampling, right? So they take the few cases and they extrapolate into a guesstimate number.
Yeah.
So it's not like really every case of Lyme disease is being reported, and we can say, okay, this zip code is worse, this county is worse. It's part of the problem. There's no good tracking numbers. So therefore, it's hard to then know when we're making progress too, or when the health department is making progress. We can't say, oh, this year is better than last year, or there's no good numbers. So that is one of the problems nationwide. And every state does it differently, but that is one of the problems we face. There's no good data.
And let me just say,
Yeah.
500,000 people are reported as having tick-borne diseases a year, 500,000-ish. I was not one of that number because I was told I had sleep apnea. So I was reported as sleep apnea, not Lyme disease. Same with Royale. So the 500,000 are definite sufferers, but there are a whole bunch of us who are out there who are unreported.
Sure.
Right.
Or reported as MS or fibromyalgia or whatever.
And to make that worse, the long haul piece is completely missed. So, if I'm going and I'm getting physical therapy, I'm getting pain meds, I'm getting mental health care, neurological things, those are all coded as neurological, chronic pain, back. None of them are coded post-treatment Lyme. So we have no data on that, the follow-on chronic, So again, a lack of data makes everything harder. We can't control that, but it is immense frustration for us. This is just some of the stuff we've done, pictures we pulled down. This is an example of the type of education that we do. You've got the handout, so this is just taken from the handouts. Our educators go out and give workshops and try to educate people on what to do. That's just an example of that. So then this is the $75,000 that's in the contingency budget. We needed to support our education program in Onondaga County. And that would be a portion of educator salary expense, our communication consultant who does the actual pushing out of outreach, education equipment and supplies, and telephone and website. That's sort of all of the main direct expenses that go into the program. And just to note, of those 146 events and 12,000 plus attendees that we've done, more than 50% are in this county. This is our biggest county. We do more work here than Madison and Oswego combined. So that's why we're coming to you first. That's the majority of we started here and then expanded. And we're trying to do more in the other counties, and it's hard. It's hard, especially the more rural the county, the harder it is. We're trying, but so that's so then questions?
I think I remember from previous presentations too that you really don't have many colleagues throughout the state doing the work that you do, if I remember.
There's nobody, honestly. There is nobody in New York State that's doing what we're doing, really. I think there's like a Get Ticked campaign and sort of a group downstate. There is a group out in Western, but they don't do public education. They're more advocacy, which is great, and we do that too, but we feel as though,
Like to have a holistic approach and a comprehensive approach.
Yeah, like we said, the easiest way to treat this is not to get it. So the more we can do to help public not get bitten by a tick, and if you are bitten by a tick, please go to the doctor right away and get diagnosed right away. We help people with that. Another part is our provider education. We're going to be doing our 3rd Lyme Summit because that's a big part of it, right? We've discovered the inconsistent level of knowledge in our providers in the area. So we're trying to get more of them on the same page with the latest diagnostics and treatments and understanding the complexities so that people are getting diagnosed sooner and not being, sent away like I was.
We were told 4 years ago when this all started by somebody who's a guru in this space with the Global Lyme Alliance. He was the CEO of the Global Lyme Alliance at that time, and we called him just to ask him, we don't want to start from square one, help us out here. I thought it was going to be a 15-minute conversation. It turned into a 45-minute conversation with this wonderful man who is a guru. He told us at the end of that conversation that we are the only one, and that was 4 years ago, we were the only one in the country doing it like that. He wanted to make us a pilot. So fast forward, all of those numbers that Royale put up on the screen, up to 3 million people on social media. I can't believe that. We absolutely have traction now. To the point, so that's the good news. The challenging news is it's hard to keep up. I don't know how many calls the 2 of us get a week saying, oh my God, I just had a tick on me. What do I do? Where do I go? Where is that lab anymore? It's closed. We're not part of the lab, but it has been integral to our operations. So yeah, we have traction now. I'm just going to speak on Saravanan behalf. He's the only lab in New York State who's doing what he's doing, by the way. Your investment in his lab is a really big deal. Your investment in us is a really big deal. Would be a really big deal.
Any other questions, discussion?
Resident, do you mind if I just have a question? Just the 24-hour rule, is it a real thing where if you catch the tick within 24 hours, you're generally safe from Lyme? Or
Okay.
Got some public education.
All right.
I'm using that as
She's going to go Larry for this.
All right. Now,
We need to say we're not.
And if you're not doctors,
right.
I can talk to my healthcare professionals over here.
That's always I am not a doctor.
Yeah.
I cannot give medical advice,
Yeah.
nor do I play one on the internet. Right. But the general rule of thumb is 24 hours for Lyme disease specifically. Though I will tell you, again, this is part of our collaboration, right? We have our ESF researcher and our lab researcher and our infectious disease doc who argue about that.
Gotcha. Okay.
And they're now down to maybe 18. So that is, I would say that's subject to change, right? There is discussion. Nobody exactly knows. The caveat is there are some diseases that can be transmitted quicker, like Powassan is 15 minutes, something like that, and we don't know about the newer ones. So, If anybody is bitten by a tick, I tell them, go to your doctor. Perfect. You need to talk to your doctor and assess your risk and what you should be watching for and testing for and those sorts of things, because at this point, there's so much we don't know yet.
Thank you so much.
Yeah.
I do have one more question. When you go out to the schools and to some of the other places, I would hope that you would say that some of this is being underwritten by Onondaga County.
We absolutely could do that.
You know, I mean,
Yes, yes.
It's important for the residents to know that
Yes.
we're in this with them.
Absolutely, absolutely. We would love that. I think it's a good indication for us to have buy-in, from the counties. And, and we will eventually go to the other counties too. We need to have buy-in. And we have a good relationship with Katie in the health department. We're working on the other counties' health departments. We all need to work together. And that's the way we sort of see it. That is what makes us different than the other organizations in the country. We want to work with everyone.
Legislator Bush, I think that's one of the things that you had asked about in previous meetings was efforts in other counties, and I'm certainly happy to hear that you're finding some more traction. Could you speak to the growth of your organization over the years in terms of being able to fundraise, for example, to support the work that you're doing and have conversations with these different entities and municipalities?
Sure. Well, in the beginning, we had nothing, no staff, no budget. No board, nothing, nothing,
people.
yeah. And then we got a few very small grants from local foundations to get going. And then our budget has gone from, off the top of my head, I want to say it's maybe 150,000 the first year to 400 and change this year. So exponentially growing. And along the way, we've had Mother Cabrini Health Foundation is a major grantor for the area. Shinneman Foundation in Oswego, Gorman in Madison, Reisman that underwrites some of our tick kits. And so we have some foundational support. We have the last 2 years, we've gotten $50,000 through Senator Mannion from the state. So we're getting some state buy-in, though.
And Al Sturpey.
And Al Sturpey, that was 2 years ago, yes, who gave us 18. So state depends on the size of their budget. We've been told they're not going to put it in the budget. It's always going to have to be discretionary money we're fighting for, but so some of that, our individual fundraising from donors and corporate sponsorships has grown. Last year, I think we doubled, about 80. This year we're targeting over 100. So we're kind of slowly trying to grow all of the funding streams. Sure. Because the grants from the foundations aren't going to last forever. So we need to be able to be sustainable with a kind of multi-pronged outreach, if you will. Yeah.
And with regards to the financial side of this, for the legislators who weren't here during the 2024 budget cycle, this is money that exists in contingency allocated to this purpose that we're talking about, if you weren't aware. But any other discussion? Okay, do I have a motion? Legislator McCarron.
Second.
Legislator Harvey seconds. All in favor? Aye. Any opposed? Okay, the motion carries.
Thank you.
With no other business, do I need a motion to adjourn? Okay, we are adjourned. Thank you, Mr. Chairman.